healthy healthcare ecosystem is also one that discovers new technologies for disease and injury. One of them, Nirvgen Pharma, just released results from a clinical study of a drug aimed at treating spinal cord injury. Mike Kelly is president and CEO of Nirvgen Pharma. Mike, thanks for being with us.
Thanks for having me.
Well, let's start with the most important news, and that is the results of the clinical data. What did it show?
Well, the data showed that our drug candidate, NVG-291, can actually increase connectivity between the brain and the upper limb, the hand specifically, after the subject has a spinal cord injury. So it's a pretty dramatic breakthrough. That was the first discovery. The second was that connection can actually turn into functional improvement. So there were two real big aha moments when we looked at the data. The first was the electric connection that gets past the site of injury has improved. And the second is people could use their hands much better.
So that's obviously an astonishing development for this category, of course, which is catastrophic injury. Just give us this for those that aren't in the biotech space. What is the kind of level of that trial, the clinical trial? Where are you in sort of the stages of them? There are different stages. How advanced are you, in other words, to saying this is a real thing?
Well, this is what we call a phase 1b/2a trial. It was a proof of concept. We have phenomenal data in animal models, and this was our first foray into actually testing people who have spinal cord injury. The results here, though, we have statistical significance in our primary endpoint, which is the connectivity I talked about, and we also had very strong trends in functional. So it's a huge step forward for a patient population that has nothing. So our next step is to continue to look at all of the data. This is just the tip of the surface that we looked at, the primary and secondary endpoints. Gather all that data, have a meeting with the FDA, and talk about our development path moving forward.
And how long is that path, Mike? I mean, I know it can take a long time for the people that are obviously investors are interested, but for the potential patients, the big question will be, when can this be something I can try? How long till you get some sort of FDA approval or similar?
Well, the path is, there's a spectrum of outcomes here after we meet with the FDA. On one end of the spectrum, this could be enough to show that we do see an effect, and we could potentially get accelerated approval. We don't know that. We have to talk to the FDA about the strength of this data. And then the other end of the spectrum is if they say, well, we want to see more before we get approval, we'll have to do a larger confirmatory trial. That'll take us about a year and a half to complete. And then you submit to the FDA and you're approved after that. So it ranges anywhere between, 2027 and 2028.
And of course, one of the big questions in the process for companies like yours is, do you have the capital to get there, and whether the environment is good, or are you confident in your ability to fund this through to the end?
I am. I'm confident with this data that we're going to be able to get the money that we need. You don't see breakthroughs in science like this too often. We have a lot of interest in the company. We have a strong shareholder base that has helped us to get to this point. And I'm very confident that we'll be able to raise the capital to do the next step in development and get this thing to patients as quickly as possible.
And of course, it is a big breakthrough, obviously. Mike, is there anything else like it in the world that you can compare to?
Nothing. There's nothing like this. This is the first time that anyone has ever demonstrated with a drug that is delivered through a needle subcutaneously in the belly, just like insulin is. And that has turned into regeneration, remyelination, and enhanced plasticity, which is fancy words for regrowing connections between the brain and muscles in the hand. So nothing has ever demonstrated this. This is also in a patient population who was injured chronically. Mm-hmm. They had their injury 3+ years ago. So they had some performance, or they had some improvement. That improvement plateaued, and they were where they were for the rest of their lives. And now we have a catalyst to actually give them hope to continue to improve. So it's a pretty significant medical breakthrough. There's nothing like this in spinal cord injury.
Mike, so good to have you with us. Appreciate your time.
Thank you. Appreciate your time.
Mike Kelly is president and CEO of Nirvgen Pharma. Coming up, teaching your people how to think creatively and build the next generation of business. That's still ahead.